complex pregnancy, Emma, is one that belongs to one of the three groups. Either you have a pre-existent medical condition like diabetes, epilepsy, or heart problems, for instance, or kidney problems, which may have an impact on your pregnancy. Or your pregnancy itself could have an impact on a medical condition that you've had previously. For instance, a condition that was quiescent and in remission all the way along can reactivate in some cases in pregnancy, and pregnancy can worsen the medical condition. Those kind of groups belong to a complex pregnancy. Sometimes, however, you could have a completely normal pregnancy and some complication develops mid-flight, and that would mean you move from the low risk to the complex category. I personally don't like the terms high risk or difficult pregnancies, simply because they are unhelpful labels and serve only to frighten the mother. The difference that we've introduced is that we've moved away from the concept of a consultant named clinic to a patient-centered clinic, which is run by a specialist team consisting of an obstetric specialist and an experienced midwife. And all the support and questions that might arise during the course of the pregnancy, the patient knows whom to contact to clarify these issues. We also put them in touch with good websites and support groups, and when we see them for the first time, for instance, the Epilepsy Society or the Lupus Society, which they get more information from, and we find that that does help patients a lot. Some of the clinics that we run are maternal medicine clinic, where I get to see patients with pre-existing heart conditions, liver, kidney or blood disorders. We see patients who are diabetic or who have thyroid problems in the joint endocrine obstetric clinics. We have got a small baby clinic where if there is a problem with baby's growth or there's been a previous problem with growth, they're seen in this clinic with special scans. And we have the multiple pregnancy clinic for twins, triplets, etc. But as a very new introduction, which is not found in several hospitals, we actually run what is known as a Willow clinic that's once a week. And this is the clinic where any patient who is planning a pregnancy and has pre-existing conditions such as lupus or diabetes or epilepsy, or indeed certain blood disorders, and where pre-pregnancy assessment and advice is so important to ensure a good outcome in a future pregnancy. These are the patients we would see in the Willow Clinic. They need to be referred by the GP, and patients shouldn't hesitate to ask their GP for a referral to this clinic before they actually start the pregnancy, because there are certain interventions, certain medications that either need to be added or changed right from day one. And this clinic also gives an opportunity for a second group of patients to be seen, and this group is a patient who might have had a difficult delivery or a sad outcome to a recent pregnancy. They are seen in the clinic in order to discuss what went on in detail with the benefit of the notes, with the senior consultant giving enough time to individual cases, as well as an opportunity to discuss what could be done differently for a future pregnancy. So this post-pregnancy debriefing and counselling is an essential part of the new clinic setup. What I'd like to reassure every patient who comes through to a complex pregnancy clinic is that although the condition you've been told that you have might seem worrying or baffling to you, please be reassured that the specialist team has seen many of these conditions and will refer you appropriately to tertiary centres if it is a condition that is so rare it needs more multidisciplinary care. Don't be afraid to ask, because if you do not understand the condition, you will not understand the investigations or the interventions that we would suggest. All of us have a common compendium, and even rare conditions are explained clearly. So we are here to help you clarify any doubts, to explain the condition, its possible impact on the pregnancy, or the possible impact that pregnancy might have on your pre-existing condition.